Hello everyone, Namaskar. I am Professor Dr Indranath Ghosh from North Bengal Medical College, Department of Chest Medicine. Basically, I am going to talk about asthma, one of the leading chronic respiratory disease in India. It is said that almost 3.8 crores of patients are having asthma in India, and each year almost 14,000 people die of asthma. So you can assume what a vicious important disease it is. What patient feels is basically, what are the symptoms actually, is basically chest tightness along with shortness of breath, dry cough, which is mostly nocturnal. There is a diurnal variation between the symptoms, and then you go to a doctor, you consult your doctor, doctor then checks you. What they find is basically wheeze, and you can see listen also wheeze. Sometimes when it is more asthma, you can listen the wheeze from outside even without a stethoscope. Then a doctor does a pulmonary function test, a spirometry it's called, and we see a thing called bronchodilator reversibility test, and then we put it on mainly inhaler therapy, inhalation corticosteroid. Now there is a taboo on inhaler use in India. We are well aware of that. We have to make people understand that this is basically the cornerstone of the therapy. See, whenever you are having a skin disease, what you do? You apply a skin ointment. Whenever you have an eye problem, what you take? You take eye drop. Ear problem, ear drop. Why? Because it directly goes to the site of inflammation. Same here. When people are suffering from asthma, that is inflammation of the lung. So if by any way I can deliver the drug directly into the lung, that would be nice, that would be fine. The dose will be less required, the side effect will be less. So that is basically inhaler. It is nothing but a deliveration of the therapy itself. So you take inhaler, and most important thing regarding inhaler is, for patient perspective, is the inhaler technique. How you take. So make sure your doctor explains you how to take the inhaler in right way, because that's going to be a crucial in your asthma therapy part. Apart from that, you have to avoid the trigger factors like the cold weathers, the ice cream, cold drinks, maybe the perfumes and the fumes and all these things. And you take regular medicines as prescribed by your doctors, mostly nasal steroids, and then you will be safe. Your lung will be safe, and you will be safe from asthma.